With fears hospitals could soon be overwhelmed, both Ontario and Quebec are headed back into lockdown. In Quebec, non-essential businesses will close starting tomorrow. Ontario's province-wide shutdown goes into effect Boxing Day. The decision to wait until the 26th to impose restrictions is sparking criticism and concern. Mike Drolet has tonight's top story.
Call it the storm before the calm, before an even bigger storm. With the countdown to the lockdown ticking away, there was no holding back the Christmas frenzy in and around Toronto.
I was in Walmart up on Eglinton this morning. That place was packed. Packed.
It's enough to make health experts cringe and fear the worst. A surge of Christmas-fed cases of COVID-19, unlike anything Ontario's healthcare system has seen before. Dr. Anna Banerjee worries the province's intensive care units will be overwhelmed with what she says will be a tsunami of new cases in January, which biostatistician Ryan Imgram predicts in new modeling will translate into an extra 10,000 new cases over the next month.
I fail to understand why it was started on the 26th, other than it being potentially political. So if you're going to impose a lockdown, why would you do it after the most dangerous time?
Why indeed? Ford says he ordered the 5-day delay to allow businesses to offload inventory. And besides, he says, he still urges Ontarians to lay off the big family dinners.
No, I'm not compromising anything.
Public health officials had warned in the fall that if the number of COVID-19 patients in Ontario ICUs surpassed 150, surgeries would have to be cancelled. There are now nearly 300 patients in ICUs. And the province's modeling suggests that in the worst-case scenario, there could be demand for over 1,500 ICU beds by mid-January if Ontarians don't heed the social distancing warnings. Banerjee says Ontario just doesn't have enough ICU doctors, nurses, and ventilators to treat that many.
If there's no place for them to go, you've got a healthy 50-year-old who's, been healthy their whole life, and they get COVID, and all of a sudden, it's affecting their lungs. If there's no ICU or no ventilator machine, then they will die.
Similar scenarios played out earlier this year with tragic results in New York and Italy. Hopefully history doesn't repeat itself. Mike Drolet, Global News, Toronto.